Hello everyone, and welcome to this audio podcast. This audio podcast is part of a Bostix series. This audio podcast is part of a LaBox Infaction. This audio podcast is part of a Storm Quota, and this audio podcast as part of a Storm LaBostics production. In this audio podcast, this synopsis, a little bit in around a in around some works that have been recently sort of co-developed and sort of hot off the press, if you like. And basically, where this works is again this works where this works not only being sort of co-developed but also collaborative. Looks at sort of practice excellence in line to integrating healthcare education for those who go through through sort of chronic illnesses or conditions, and where this works the links into works in around two social media organizations and platforms. So a little bit around this works then. Online spaces have allowed or encouraged patients with long-standing conditions to access information through websites, portals, and patient-centered organizations, conducting a retrospective pilot descriptive analysis of tag themes or topics between two online social media platforms. The hypothesis surrounding this works is that those patients with chronic kidney disease or CKD require more integrated healthcare service or services involving healthcare professionals through social media platforms, so that healthcare between online and physical space, where service users and providers are empowered. In around sort of the sort of methodology around this works between two research social media between two sort of social media platforms, two social media platforms, the Renal Patient Support Group and the Kidney Disease and Renal Support Group, or KDOS Group for Kids, initially co-developed themed topics and tags, which have been applied against threads. Thereafter, a target sample was implemented to seek 100 responses between two surveys, one survey for patients, and a second survey for allied healthcare professionals, or AHPs, to understand how healthcare service for patients could be enhanced. Survey URLs or links for participants to work survey links survey URLs or links for participants to complete were actioned mainly through the RPSG platform, and participants were invited to complete a survey only once, and specific software was utilized to analyze and describe the data. So in around the results and analysis of this works, 19 surveys were completed by allied healthcare professionals, AHPs, and 45 were completed by those whom had who had were completed by those who had CKD, chronic kidney disease, or by CKD patients, and the highest responses were from allied health professionals. The responses from allied health professionals were from female backgrounds, where the num the num the where the number was just below 60%, 57.14, versus males, which was 42.86%. And related to CKD patients, females again had were females completed the survey or the URL through the URL at the highest at 55% versus males at 38.89%. The types of allied health professionals included healthcare scientists around 47%, nephrologists 17.65%, allied health professionals at 17.65%, and general practitioners at 5.88%. And the patients cohorts included transplanted recipients at 60.53%, hemodialysis recipients at 13.16%, and CKD patients generally between CKD stages 3 through 5 and around 10.53%. In around the conclusions of this works, this was the first international pilot retrospective investigation that examines how healthcare service provision could be enhanced and informs of a need for patient and healthcare professional involvement through social media and or online space, and between pediatrics and adult nephrology cohorts. That draws this audio podcast to a close. This audio podcast Synopsis is part of a Bostix series. This audio podcast as part of a LaBox Infaction. This audio podcast as part of a Storm Quota, and this audio podcast as part of a Synopsis as part of a Storm LaBostics production. Thank you.